So now I'm going to hand things over to Michael Clausen, who is CQL's Director of Personal Outcome Measures. Michael.
Hey, thank you, Seth, and thank you all for being with us today. We are excited to present this installment to you, really focused on the why of the personal outcome measures. Why do we use the tool, and what value does this bring to people and organizations? So we're going to start today with an activity. So what I want you to do, use the Q&A feature on Zoom if you want to find that. And what we want you to do is note the three most important things in your life. Okay, so while you are doing that, I'm going to go ahead and tell you about the vision and the mission of CQL. So, our vision is a world of dignity, opportunity, and community for all people. And our mission is dedicated to the definition, measurement, and improvement of personal quality of life. And so today we're going to be talking a lot about that idea of measurement, and we're going to be focusing a lot on quality today as well. So let's see what you came up with. What are the most important things in your life? So I see family, hobbies, pets, sleep, purpose, health, freedom, safety, experiences, travel, choice of how to spend my free time, friends, having a roof over my head, odd family, making a difference, animals, my career, finance. These are really good. I'll read a few more. Happiness, the gym, parents, my husband, independence, self-care, my image, good one. My social circle, gardening, okay. Friendship, all right, are really good. Thank you all for sharing. So you may have selected items like family and fun. We did see those. We saw money, love and relationships, work and career, spirituality and success and home, health, privacy. Um, so we did see these from all of you, and these are some common ones that we typically see when we do this activity. So let's look now at some of the similarities between what you noted as what is most important to you and the personal outcome measures. Okay, so the personal outcome measures, you'll see these first two factors, safety, health, right, okay, using the community. The next three factors, natural supports, so family, friends, people noted intimate relationships, privacy, okay, making choices. So personal outcome measures really are the things that are most important to all people. So not just people with disabilities, but all people. And then we do see a lot of similarities between what people generally know as what's most important to them and the personal outcome measures. So this really is designed to be a multidimensional approach to looking at the whole person. Okay, well, thank you all for sharing. So we'll jump in. The POM supports us, and I'm going to use that term POM today, personal outcome measures. Sometimes we abbreviate it to POM, so you might hear that. The POM supports us to build quality of services and promote quality of life in three distinct ways. person-centeredness, measuring quality, and the transformation of organizational culture and values. We're going to start with this first category of person-centeredness. How does the POM help us to deliver person-centered supports and services? Let's think about this concept of outcomes for a minute. There are different types of outcomes that we may interact with in supporting people. So we have functional outcomes. And so a functional outcome is focused on increasing functional status in a designated area. So as an example, physical therapy increases range of motion, which then enables a person to perform additional activities of daily living. This change can be measured through standardized scales and compared to norms for various groupings of people. We also have clinical outcomes, which focus on cure and symptom reduction. For example, reduction in seizures or the symptoms of depression are examples of clinical outcomes that we might reduce through the use of medications. One way of recognizing that services and support are directed toward clinical outcomes is that people may be referred to as patients. Clinical outcomes typically are recorded in medical charts and measured through utilization review. Personal outcomes are a bit different. Personal outcomes focus on the items and issues that matter most to people. So some of those things that you noted earlier, family, your career, privacy, or independence, okay, those might be personal outcomes that are most important to you. Organizations that support personally defined outcomes recognize the connections among services, supports, other interventions, and the whole person. So again, really focused on that entire person. And importantly, personal outcomes are defined by, you guessed it, the person. So we don't ever assign a specified frequency or scale. With personal outcomes, people decide what their best possible health looks like, what rights are most important to them, and how they want to engage with their communities, and what goals are most important to them. People define their own outcomes based on their likes and dislikes, as well as their personal experiences. We learn about personal outcomes only when we talk to the person and learn what is important and why. Outcomes focus on what is most important to each and every person. Outcomes guide organizational and staff supports to focus on what is important to and for the person. The personal outcome measures require a process of learning, facilitating, and finally, measuring. Which outcomes are present in the person's life, and how do we shape our supports to be responsive to those outcomes as they are defined by the person? Learning about, facilitating, and measuring formally defines how to implement the POM. So you may have heard of the 3 E's, and we're going to talk about them later. We also have the 3 A's, which is ask, act, and advocate. This highlights an acronym which summarizes how the process works. Active support is required to enable the presence of outcomes and supports. So we have a story to share with you today, and we have a collection of these stories available on our website of how the personal outcome measures have been used to truly discover and enable what is most important to people. So with this story, Joshua embodies a person-centered approach in his role as direct support professional at Life's Work in New York. Joshua also uses the personal outcome measure process to learn about and improve the lives of people he supports. During an interview, a person receiving support shared that he wanted to interact with other members of the community, participate in the life of the community, and use his environments. The person had a desire to get a haircut at a neighborhood barber for the very first time, and previously been receiving haircuts from his mother. So Joshua helped identify a barber who specializes in working with people with autism. They spent time together with the barber, talking through the process and sharing details about what the person wanted out of the experience. And when the time came for the haircut, the person was at ease. He loved the results, and it was a true success. He was so happy to have his first haircut by a real barber instead of his mother. He's now preparing to try a barber in his neighborhood and is very positive about being active in his community and not just part of a support service specific to people with disabilities. And the key to Joshua's effectiveness is his ability to really get to know each person as an individual through information garnered through the personal outcome measures discovery process. And we have another story for you, again, from our website. In James' personal outcome measures interview, it was discovered that he was lonely and wanted a girlfriend to share his life with. James eventually met Amber. They attended community events, movies, and began to develop a friendship, which eventually developed into a romantic relationship. And Tammy, a direct support professional, provided desired support for James as he explored what being in a relationship meant for both him and his new girlfriend. Tammy has been a stabilizing force throughout their relationship as they have experienced the inevitable ups and downs with any relationship. As their relationship developed, James and Amber decided it was important for them to live together, and they were supported to move into their own apartment. Tammy's support was very important in helping the couple move in together while providing assistance with the logistics involved in that transition. After being together for 2 years, James and Amber were able to go on their first vacation together, a cruise to the Caribbean. Through James' determination, along with the support provided by this direct support professional team, James is now exactly where he wants to be in his life since his personal outcome measures interview. So the person that Joshua supports was able to become more connected to his community, and James and Amber were able to move into their apartment together. So why does all of this matter? Well, the short answer is that it's all connected. Relationships outcomes, rights outcomes, dignity and respect have a huge impact on all outcomes, including health and safety and overall quality of life. Now, at CQL, we do a lot with data, we do a lot of research, and we have some very fascinating research on social determinants of health that relied in part on the personal outcome measures. So we'll be looking at some of that today. And just a fascinating bit of data for you here. The annual number of emergency room visits is 60% lower when organizations facilitate each person's desire for natural supports. So if we want to keep people healthy and safe, we also have to look at their relationships as well. That's really important. Similarly, we can reduce injuries by enabling people's relationships. So the annual number of injuries is 68% lower when organizations facilitate each person's desire for natural support. Once again, with the personal outcome measures, we really focus on whole person, and all of these quality of life domains are interconnected. So rights has a profound impact on people's overall quality of life as well. And people who exercise rights are 3 times more likely to be free from abuse and neglect. So the POM supports us to better understand which rights are most important to people and how to help them exercise their rights effectively. So the POM really helps us to look at the whole person and enable their outcomes as they define them. So in summary, the personal outcome measures helps us to enhance person-centeredness by moving away from the traditional cookie cutter goals such as ADL skills, household tasks, all of those goals that we might traditionally see as part of someone's plan. The POM helps us to discover what's most important and meaningful to each person. So, relationships or the person who wanted to spend more time in his community, the POM helps us to truly understand that and enable those outcomes for people. The POM helps us to enable truly person-centered plans and create more responsive supports. Um, the POM helps us to track progress towards individually defined goals, get to know the whole person, celebrate achievement and success, and most importantly, support the highest possible quality of life for every single person that we support. Okay, so at this point, we will move on to the next main category, and that is measuring quality. Let's take a moment to reflect. How do you know if your agency is providing quality? How do you know? Okay, now I think we can all agree that providing quality services is important. We all want to have a reputation for quality, and we want the people that we support to have the best possible services. But let's think about that for a minute. How do we know if we are truly providing quality at our organization? Now, you probably have a lot of data. You probably collect and analyze data on incident management, staff turnover, medication errors. But how do you know if you are truly providing quality services for every person that you support based on their definition? Okay, so think about that. Now, we have another activity that we're going to do together. So what I'd like you to do is, once again, we're going to use that QA feature, Q&A on the Zoom control panel. And I want you to name a product or a brand that represents quality to you. Okay, so what product or brand really represents or signifies quality to you all? I'll give you a few seconds here and I'm going to read some of these responses. Okay, I'm really excited to see what you all came up with. Okay, oh, scrolling to the top here. All right. Oh, somebody said CQL. No, we didn't pay them, but thank you. Uh, okay. Toyota, Louis Vuitton, Lexus, Apple, uh, Johnson and Johnson. Okay, lots of Apple here. Tesla, Mercedes, St. Jude's, Burton, Hellman's, Chevy, Ford. Okay, HP, Mary Kay Skincare, Skechers, Rolex. right. Burt's Bees, Patagonia, Honda, BMW. Okay, wow, a lot of cool stuff here. Jeep, Calvin Klein. Okay, all right. A lot of good examples here. Uggs. All right. Well, thank you everybody for sharing. So, the thing that we all always notice whenever we do this type of activity is that these definitions vary from person to person, right? You all have your own perspective. And as we saw with the responses, some people like Chevy, some people like Ford, some people like Toyota, right? And that's based on your own experience, your own perspective. So each person has their own unique definition of quality. And the same is true for people that we support, right? Quality to one person that we support is probably going to look totally different than it would to another person that we support. Okay. And the palm really helps us to discover what that definition is. How does each person define quality? And how do we respond to that unique individual definition of quality? Okay, so traditionally in our field, um, we did things a little bit differently. So in the past, evaluations of quality focused on ensuring that a sameness or uniformity in policy and procedure existed and that those policies and procedures were consistently followed. And traditionally, quality was defined by the extent of compliance with those organizational process standards, right? So, and of course, who came up with those process standards? It was the professional, right? Not the person, but the professional. So inspections identify but do not contribute to the correction of deficiencies. Improving quality really requires us to move beyond compliance and move beyond inspection, right? Because just because we are in compliance with the minimum standards that are set forth by our governing agencies doesn't necessarily mean that we are truly providing quality from the perspective of each person that we support. Okay, so that's what the POM helps us to do. What is that definition? How do we respond to it? So the movement from a process or a program focus to a personal focus is occurring across all services and manufacturing systems. Service organizations have recognized that rather than just provide a service, they must satisfy the customer. Even a service intended to be customer or person focused, such as supported employment, can be process or program oriented when jobs are thought first and then people are plugged into those jobs. So attempting to determine an individual's preferences and then seeking jobs based on those preferences would be more of an outcome-oriented focus. In a person-centered and outcome-driven approach to quality, we are discovering what is most important to the person, and then we are designing our supports to be responsive to that definition. The measurement of quality has shifted from a focus on compliance with organizational process to a focus on responsiveness to individually defined outcomes. So consider the differences in the meaning of the words assurance versus enhancement. Assurance means making sure that minimum requirements are met, whereas enhancement means going above and beyond what is minimally required while not forgetting those minimums. So to get above the floor of basic assurances, we need new methods of quality. So, and so we're clear, we can't stop doing health and safety and meeting those minimum requirements, but we really need to engage each person that we support to truly enhance quality at our organizations. As organizations move to a personal outcome approach, they will be faced with meeting different expectations. The ability to function in constantly changing, often unclear situations will be required. So once again, that tolerance for ambiguity, right? Moving away from some of those cookie cutter goals that we're so used to seeing, the ADL skills, the hygiene skills, and really embracing that ambiguity, really embracing the gray. The ability to function in constantly changing, often unclear situations really will be required of us. We will have to relinquish that control and support people to take risks without abandoning them. Um, we do want to make sure that they're aware of consequences as well, but it is important that we support them to take risks because that is how we learn. We need to develop new people skills such as asking, listening, and negotiating. People are constantly growing and changing. They take an increasing number of risks as the capabilities and confidence increases. However, support and safety assurances are still required. Okay. So finally, embracing change as the constant, and it's not change simply for the sake of change. It is change in that we are constantly improving quality at our organizations. And this really is a journey. We never really get to the end, but that's okay because we are constantly looking at how we can improve as organizations and service providers. In summary, we can enhance quality through use of the palm by understanding quality through the unique perspective of each person supported. We can use the data that we collect through palm interviews to identify the strengths and opportunities that we have as organizations and then direct our resources accordingly. We can use the tool to measure the effectiveness of critical organizational systems, measure the quality of organizational practices and staff supports, better respond to people's changing needs and preferences, and importantly, enhance the quality of our organizational supports overall. Okay, so the final category that we're going to discuss today is transformation of organizational culture and values. Now let's take a minute to think about this. And we're not going to use the Q&A. Just want you to kind of think about this for a minute. How many of you chose where you live? How many of you chose who you live with, have personal space and time alone, come and go as you please, set your own schedule? How many of you choose how to spend your money and choose who cuts your hair? How many of you choose which grocery store you go to or which pharmacy you use? How many of you choose your doctors or your religious service? How many of you choose where you work? Okay, so just think about that. Hopefully you said yes to a lot of these, that you do choose these things, or maybe you choose these things in conjunction with your family or significant others. Now, let's think about people that we support. Okay, think about some people that you know who receive services. Now, how many of them truly choose where they live? How many of the people that you support choose who they live with? And how many of them really have personal space and time alone? Can they come and go as they please, set their own schedule, choose how to spend their money? Do they choose who cuts their hair or which grocery store to go to, which pharmacy to use? Do they choose their doctors? Do they choose their religious services? Do they choose where to work? So just reflect on that for a moment. And importantly, the personal outcome measures is not a satisfaction survey. Okay. It's not really about seeing if people are happy with their home or happy with their doctor or happy with their pharmacy. We really don't ask those questions because oftentimes asking people whether or not they are satisfied is based on a false pretense. People receiving our supports may not have ever experienced other options regarding their services, where to live, where to work, choosing and creating their own routines and schedules. They may not have never experienced those different options. So simply asking them whether or not they're satisfied, it's not a great way to really assess their overall quality of life. So the POM challenges us to maximize choice and control for people that we serve. So now it's time to talk about the three E's. And if you're familiar with CQL, you probably have heard this. We talk about this a lot because it really is about choice and control. Okay. So education, experience, and exposure. All right. So the POM really is premised upon this idea of choice, control, rights, and individually defined quality of life. Now, whenever we talk about choice, what we are really talking about is informed choice. So, what do you need in order to make an informed choice? If you were looking for a service provider, such as an auto mechanic, a doctor, or a childcare provider, how would you go about choosing? You might ask friends or family for recommendations, or look at online reviews to identify the best option. You might make certain compromises due to cost, location, or availability before landing on the best possible option, but you will have made an informed choice about the option you selected. If you don't like what you have chosen or have a bad experience, you might choose another option from your list. If you are happy with what you have chosen, you might refer your friends or leave a positive review to support others to make an informed choice. So, choosing control really are foundational. And let's think about the people we serve, right? So, do they have the same degree of choice and control that we have? Do they have the same number of options? Even for things like bank, pharmacy, medical providers, okay? Can they even choose their shampoo? So the POM really does challenge us to back that choice and control that people receiving services can have the same rights, freedoms, experiences, and ultimately the same quality of life that we all have. And once again, it really does go beyond compliance, right? So um, looking beyond simply health and safety, and we'll talk a little bit more about why that matters. But the POM focuses on all of these other areas as well: relationships, financial security, respect, social roles, choosing goals, making choices about our lives. So once again, the POM helps us to transform from cultures that are focused solely on health and safety to organizational cultures focused on the whole person. So as we've mentioned previously, it's all connected, and people's social and physical environments do have a profound impact on their overall safety and health. So health equity demands much more than simply controlling or preventing disease. And poor health cannot be explained by health services alone. Although medical care is important to health, research suggests medical care itself is only responsible for 10 to 15% of preventable mortality in the United States. And in fact, health is largely determined by social and physical environments. According to the World Health Organization, the roots of most health inequalities and of the bulk of human suffering are social. So again, we do a lot of research on this idea of social determinants of health. And the research is clear that to improve that health, we really do need to focus on those other social determinants, the relationships and people's social environments. So once again, we showed you some data earlier on this. If we want people to be free from abuse and neglect, it's important to also consider their social and physical environments and their unique definitions of respect. So people with disabilities are 2.5 times more likely to be free from abuse and neglect when they are respected. Okay, similarly, if we want to lower injuries, we must look at all of our organizational systems, including having a visible and accessible complaint process. So the annual number of injuries is 54% lower when organizations respect people's concerns and respond accordingly. And we can lower emergency room visits by promoting dignity and respect as well. Okay, so this quote unquote challenging behavior events is 83% lower when organizations treat their employees with dignity, respect, and fairness. So that's a pretty interesting statistic. Okay, and it's all connected once again, reducing injuries by promoting dignity and respect. We can decrease abuse and neglect incidents by 50% when people have the right to visitors. And to look here at how ongoing staff development affects some of these health and safety outcomes. Um, Emergency department visits are 40% lower when agencies implemented ongoing staff development. Injuries were 61% lower, and abuse and neglect were 62% lower. So again, all of these things are connected. Okay, and speaking about cultural transformation, well, there's a lot of transformation going on in our field as well. And particularly for those of you who are in the United States, you are probably very familiar with the HCBS settings rule. Have you noticed any similarities between the POM and the settings rule? So, similar to the settings rule, the POM focuses on promoting rights, relationships, and full access to the community. We've done a lot of work to support provider organizations to implement the settings rule. We got a lot of great resources on our website, so we'll post a link in the chat box for you to check out some of those resources. Okay, so in summary, the POM supports organizations to transform our approach from that of caregiver to supporter, enable an enhanced focus on rights, relationships, dignity, and respect, ensure that staff members have the tools needed to truly support rights, risk-taking, choice, and control, align with current best practice in our field, and importantly, transform our culture and values to become a truly person-centered organization. Okay, so let's hear from some of you. I saw a lot of familiar faces in our webinar registration, and some of you already quite familiar with the POM. So for those of you that are already using the POM, why is this tool so important to you and your organization? So we'll use the Q&A box once again. So for those of you using the POM, if you could share why you're using the POM and what value it brings to you and your organization, we'll read some of your responses. So as you do that, I'm just going to go through a few more slides here, tell you a little bit more about some of the stuff that we're doing here at CQL. For those of you who are familiar with CQL, you know that we do accreditation, training, certification, research, and consultation. And we are committed to supporting our partners to improve quality of services and most importantly, overall quality of life for people. So, and the POM is part of that. The POM really helps as part of that foundation to move organizations closer to those person-centered practices. Okay, so sharing best practices and resources for free is a source of pride for us at CQL. We really do love to share. We have compiled an extensive collection of articles, guides, manuals, and webinars on our website. So check those out. We got a lot of good stuff, much of it for free. And we do have some upcoming events as well that you can register for. A couple of them are sold out now, but we do have some POM workshops coming up in June and August if you'd like to learn more about the POM and develop your expertise. We do have some workshops upcoming, so we'll post that link. And if you really want to take your POM expertise to the next level, we do offer certification for interviewers and trainers as well. So again, we'll post a link in the chat if you're interested in pursuing POM certification. There is some information about that on our website. Okay. And we do have some other trainings coming up as well, some staff development. We saw earlier how enhanced staff development can promote outcomes for people. So some opportunity for that. We have topics on money management, relationships, community, DSP initiatives, and technology. Lots of exciting topics coming up on best practices in our field. Okay, so speaking of exciting topics, here's just a few examples of some of the free webinars that we've offered in the past. We have webinars on the POM, human rights committees, day services, accreditation, and the basic assurances, HCBS settings, appreciative inquiry, communication, and lots more. So check those out. And the final installment of our Fundamentals of the Palm webinar series will be on February 15th. So hope to see you all back here for that. And check out our capstone newsletters as well. We will have one actually on the Palm coming out later this month. So check those out and consider signing up for CQL communications as well, so you can be the first to receive all of the great webinars and articles. Check out our social media pages as well. And with that, I'm going to read some of your responses about why you are using the Palm. So Kate said, using the Palm allows the people we support to determine the supports we are providing. It promotes creative teamwork that benefits everyone involved and serves to inspire both staff and people receiving supports. Okay, thanks, Kate. And Megan says the Palm tool helps us to identify areas of overall opportunity that will lead to higher quality of services and to have more person-centered outcomes for each person supported. Great, thanks, Megan. Let's see. And Melissa says it allows my organization to ensure that our members are being treated like everyone else. It lets us know if more education is needed for staff and if rights are being violated and so much more. It is a great tool. Okay. I'll read one more of these and then we can answer any questions. Michelle says to get a better understanding of the individuals we serve and to learn various ways to help them to improve their goals. All right. Well, thank you everybody for sharing. So we'll come back on camera here now, and I'm going to put up our contact info. So my email is up on the screen, and we'll see if we have any questions. Okay, so we do have a question. Let's see. Okay, so this is a good one. I may not have the answer you want here, but I'm going to read it anyway. So how do we reformat this data to get the government to provide additional funding to have the resources to fully transform? Yeah, and great question. And you know, certainly we do recognize the challenges. It's uh, lots of challenges out there, and funding is certainly one of them. You know, and there are service systems that are using the Palm and using the Palm to look at their services overall. So you know, we do collaborate with some government entities, and I will say too that CMS recently recognized the Palm as one of the tools to be able to measure quality in services. So that was formally recognized by CMS. So that is pretty exciting. So hopefully more in the future on that. So thank you for that question. Any other questions before we sign off? Okay, well, I think that's it. I want to thank you all again for joining us today. It's been a pleasure.
And a reminder to all attendees that we will be sending a follow-up in about 2 weeks with the link to the webinar recording, as well as a PDF version of the PowerPoint slides. So you can look to your email for that.
Bye, everybody. Thank you.